The Food and Drug Administration Safety and Epidemiology Center recommended that the FDA place black box warnings on all COVID-19 jabs sold to the public. Yet, Trump administration FDA Administrator Marty Makary has declined to listen to his own department's recommendation, apparently. Watch.
We have no plans to put that on the COVID vaccine. The Safety and Epidemiology Center within the FDA did recommend that. It was a recommendation formally put out. But some of our scientists and leadership, like Dr. Vinay Prasad, have said it may be different today than it was in the first year of COVID when the shot came out, because when you have those two doses 3 months apart, that's when you see the side effects go way up, like myocarditis in young people. Now that it's annual, you may not see that same prevalence, so we don't want to extrapolate findings to today if it's not transferable.
Look, this would be a stunning reversal from where everyone believed the Maha-affiliated leadership of the Trump medical team was going, especially considering that we have undeniable proof now that the quote-unquote vaccines, nay, bioweapons, are injurious to those who take them. And that there was an epic cover-up conducted by the previous Biden regime about vaccine-related injuries. According to our next guest, Dr. Talley Bowden, she said, quote, she found 1,575 patients at Houston Methodist who were admitted to the hospital shortly after receiving a COVID shot that was not reported to VAERS. Now, in one notable instance, Bowden's research discovered the tragic story of a young woman named Stacy, a 27-year-old female. Stacy got her first COVID-19 shot on January the 7th, 2022. She then was admitted to Houston Methodist 12 days later on January the 19th. Her diagnosis was initially cardiomegaly. Sorry about that. And her secondary diagnosis was hyperkalemia. She died on January 19th, 2022, the same day she was admitted to the hospital, a mere 12 days after the injection of the COVID vaccine. In fact, in May of this year, Congress determined that there was more than enough proof that the jabs were dangerous and that the federal government, in collusion with Big Pharma, covered that truth up. So why, pray tell, are we not slapping, at the very least that we could do, black box warnings on these so-called vaccines? As I mentioned, we're now joined by our friend, Dr. Mary Bowden. She's the founder of Americans for Health Freedom. Dr. Bowden, I am so hesitant when I see that HHS or the FDA or CDC is supposed to do something and we initially start cheering it. I now am so hesitant to applaud them until I actually see it through to fruition, because there's been many instances of backpedaling, and this seems to be another one. Am I wrong? I hope I am.
Yeah, it's very disappointing. I mean, historically, a black box warning gets put on a medication after 5 deaths. That's it, just 5 deaths, and you get a black box warning. And actually, the drug Paxlovid, one of the ingredients in it has a black box warning, which does not get enough press. Paxlovid is a dangerous drug. But yeah, the FDA, there's no reason for them not to act. It is truly unbelievable. 5 deaths is enough to put a black box warning on the COVID shot. In terms of what's going on with the VAERS reports, I mean, I have seen hundreds of vaccine injured patients. None of them have been reported to VAERS. And now we have some proof, and we are working on this with somebody who has access to Medicare and Medicaid claims data, who's able to compare those claims data with what's been reported to VAERS. And this person has figured out, just at Houston Methodist, this is the tip of the iceberg, that Methodist was not reporting any, after the COVID shots, Methodist was required, all hospitals who signed this COVID-19 service provider agreement with the government, they were required to report admissions to the hospital following the shots. Doesn't matter what it is for the most part. But what we are seeing is a lot of cardiac events were not reported. Even pneumonia from COVID should have been reported. And we are in the process of uncovering all this. We're gathering more data, and we plan on suing. And this could be a legal framework that we use across the country to sue every hospital out there. It could be the answer we need for accountability.
Dr. Bowden, are you able to determine yet, based on the data that you have acquired, what the percentage of misreporting or the lack of reporting, the percentage of lack of reporting to VAERS actually is compared to the people who are injured?
Yeah, unfortunately, all we can tell is who was not reported to VAERS. We can't tell who was based on the way this works.